This is Sg2 Perspectives, a conversation with Sg2 experts and industry thought leaders about the biggest trends in healthcare and what we expect that's going to mean for the future of healthcare delivery.
There is no lack of desire to create great customer experience. But where there is lack is understanding that true consumer centricity starts by investing into understanding the need of the healthcare consumers to a much greater depth than we ever have before.
Welcome to Sg2 Perspectives. I am your host, Trevor DaRin. Today, we're going to talk about consumer innovation. I have Laurie Dowd and Yelena Bouaziz, two principals who lead our work around consumer innovation and who get to talk to so many of our members about it all the time. Join us to hear what members are asking them and how they would, if they were in all of your shoes, try to turn the big ship to make all of our healthcare providers more consumer-centric. So I always value both your opinions and stories, so thanks so much for joining. Yelena, you get the first tough question. The research we did recently showed planning teams see that they need to be more consumer-centric, but they don't feel like they have the tools to do it. If you were VP of strategy or CSO, how would you try to turn that ship? What would be some of the initial steps you would take to try to make your planning efforts, strategies, new growth initiatives, et cetera, more consumer-centric?
That's where a lot of our work is focused on right now, because there's so much more awareness among health systems, to your point, about the need and the urgency to be more consumer-centric and really understanding what that is. What we say to health systems is that it's more important to get started small rather than wait until they have it all figured out and then be too late. Small steps, identifying short-term opportunities where health systems can really demonstrate that, look, there is a huge impact through being consumer-centric, an opportunity to gain that buy-in from the stakeholders across the organization and demonstrate that these initiatives can be self-funding is much more effective. That's what we see as the number one first step in order to then be able to start thinking as an organization about more expansive changes until they really reach those aspirations states. Another question that we often get is, who are the health systems that are very consumer-centric? And our answer is that nobody is completely consumer-centric right now, but health systems are doing those small things. We're seeing some health systems focusing on how to bring in growth by understanding how to engage healthcare consumers before they make that selection of the provider, how to engage them around their ability to find the provider, their ability to get their questions answered, their ability to solve for access and streamline how patients can schedule that appointment and come in to see a provider. Then we have other health systems who are starting to do work around integrating consumer-centric perspective into their ambulatory planning. If they're thinking about their ambulatory footprint, they're starting to look at, how do I integrate my understanding of how consumers interact with different ambulatory channels and build that into my strategy.
Laurie, I want to hear your take, but I have one comment that you might not care about. I feel like what we saw from payers at the end of the year was utilization went up faster than they expected. And there was probably 50 factors for that. But I think one of them was how much systems focused on access. Providers were able to increase access faster than payers were able to slow it down. So yeah, Yelena, maybe no one's perfect at it, but I think we saw that a lot of organizations were good enough at improving access and improving those handoffs and bringing that time to see a specialist down, and saw the results on the utilization side. So everyone can give themselves a half a pat on the back for that.
100%. Those are the wins that we need as an industry.
Totally. Laurie, what do you think?
Your point, Trevor, on access is really important. If I'm answering it from an aspirational perspective, I would want every single touch point to be focused on the consumer. We hear all the time about the digital front door, but all the time from when you're trying to find the system, when you're engaging with them online, when you're making a phone call and to try to make an appointment, or if you're trying to make that appointment online at 10:30 at night, and then all the way through continuum of care, but even when you're paying your bill, to make that a consumer-centric process, to leave that patient with a great experience from A to Z, so they'll want to continue to come into the system for care. That's that aspirational state that we talked about, the absolute right one where you can make the most impact. If access is the number one issue for your system, it makes a lot of sense to start there. If you cannot get through a phone line for 30 minutes, that's something that's problematic, and you're going to lose patients to other people in your market that have a better first touch consumer experience. So thinking through that holistically for your own system of where do you need to start to make the biggest impacts, and then take that phased approach and look at it from whether it's the next 6 months, the next 12 months, the next 18 months, et cetera, to ensure that you really are moving the needle over time to get to that state, which is truly having the consumer at the center of their patient care.
This might make the question even more complicated and harder, but talk about timeline. What's the long-term vision? Is this a 25-year project?
I'm stealing Yelena's answer because we've been asked this before. I don't think you ever get there. I think you're always going to be evolving because there's always going to be things that patients need. No one could have predicted that we were going to have a global pandemic. We could not have predicted that we would need to have telehealth stood up for many practices for a short period of time. And then we might go back to the way that care was delivered prior because that worked better for specialty care. That's always going to be an evolving target. Maybe it's a 2-year, 3-year, 4-year plan to do some of that groundwork that we know are table stakes to get us to where we want to be. But I don't think you ever get there. You will always need to evolve in order to meet patients where they are.
You good with that on timeline, Yelena?
Yes, 100% agree.
Cool. So prove it. Where are health systems really pivoting here? What are some of the first steps and places where they're making progress? Give me a couple stories. Give me a couple examples. Those that I talk to, there are some that are totally committed and have picked a few spots they think they can have early wins. I would say more are in the struggling to focus and prioritize bucket where it feels really overwhelming.
Absolutely. When we help organizations think through where to prioritize their starting points, the important part is to link it to where they can actually fuel growth with their consumer-centric initiatives. That's where a lot of health systems encounter barriers when they start by looking at what are all of the different ways in which we can improve experience. Let's face it, those places are countless and you can easily get lost in trying to do more than you can really bite off at a time. But what we're finding to be the most effective is understanding where is consumer experience limiting your ability to drive growth. Getting the organizations to start there. As organizations started working on access, they started seeing a lot more volumes and refueling their growth. That's a fantastic example of organizations identifying, hey, my access into my cardiovascular program is limited by the fact that patients cannot get in. So let me address the factors that are preventing them from getting in. If it's a heart valve treatment program, for example, the barrier might be actually scheduling an appointment with a specialist, or the barrier might be impatients not having the right education to know what type of appointment to schedule. It comes down to identifying it is the heart valve treatment volume that I want to drive, and then going backwards from it to map out that consumer journey and understand where is the bottleneck. Is the bottleneck in scheduling the appointment? Is the bottleneck in education? Is the bottleneck in emotional aspects? Patients either not being emotionally ready to start with the treatment, having fears, an overwhelming amount of information that they can't organize and make the decision. All of those factors become opportunities to address that consumer journey, but ultimately with the goal of driving growth in whatever the end state is. That's where we tend to recommend health systems to get started so that they can work in a controlled environment, but also demonstrate that as I'm doing X, I can have the revenue impact of Y. That paves the way for the rest of the organization to start buying in. Access is definitely one of the first places that we're seeing organizations getting started, as well as a lot of consumer journey that takes place before the patient even has an appointment, optimizing the website, the web search, the process of appointment scheduling. Laurie, what would you add?
This is a really macro example, but I heard from a member last week that was speaking, and for their health system specifically, the analogy he used was we are following the Panera model. So Panera, a quick service restaurant. He said the days of us building $100 million ambulatory surgery centers are over because you all celebrate after they're open, and then the operators are up at night trying to think of how we're going to fill said centers. He was like, however, we are trying to make care incredibly convenient for our patients to get to. He was very specific and distinct that we're not necessarily limiting our footprint. We're actually doing the opposite. We're growing it, but we're growing it really thoughtfully. And we're growing it with the idea of how can we get a return on investment, but also be consumer centric and make care really convenient for them to be able to access it easily, whether it's in their own neighborhoods, on their way to and from school, work, etc. And what can we do to really be holistic about this and be consumer centric in the way that we're growing, which I thought was well put example distilled into 5 sentences of how they have really shifted their mindsets from many other health systems that are still very much following that large ambulatory outpatient surgery center model.
All right, so let's boil it a little. Something we've been working on forever is leakage. Systems have a pretty traditional approach, but I also know it's a place that you guys have done a lot of work in shifting the data tools, insights, how focused and precise systems can get in working on leakage and how they are changing their expectations of how and what they can improve. Laurie, tell us a little more about that.
I'll give you an example. This was from a few years ago, and then how I've really seen systems evolve positively in this aspect. I worked with a large academic medical center, and they were trying to partner with a local drugstore chain to get their licensing within their drugstore chain because they wanted to expand their virtually non-existent primary care footprint because they're an AMC. They really had focused on more specialty care. That had been their historic entryway point, but needed to grow in a really competitive market. There was a huge investment and a huge push towards this. But at the end of it, they had these specific co-branded drugstore facilities that had their names on it from an urgent care perspective, but they really could not connect it back. Because they realized that, yes, while they have this great branding in their marketplace, they still haven't really solved the issue. They don't have that primary care network in order to refer these individuals to. They did not have a large OB-GYN presence for another entry point service line, as example, to refer these individuals to. They had this branding in the marketplace, but really had no way to connect it back within their system, as many systems were struggling to figure out the urgent care space and what made sense based on what their true identity was and what their goals were as a health system. Since those times have occurred, we really have seen systems evolve now more than ever, especially with all the mergers that have taken place within the health system landscape in the recent past and still continue to happen. They understand the absolute necessity of having holistic data to be able to understand what truly is happening within their network integrity. What does that look like? What are their employed providers doing? What are their affiliated providers doing? What are relationships that they don't have at all within their marketplace that are important? I had another member talk to me about this. They said, we feel like we're doing a good job at maximizing what we can do from a marketing perspective, and we have to turn our focus to physicians because we have to ensure that we are looking at what that network integrity looks like and trying to get more referrals into our specialists. So we have to not shift our focus, but make sure that those two things are working in tandem, that we're still putting the emphasis and dollars and investment into our marketing, but also ensuring that this critical point, our providers, whether employed, affiliated, or we have no relationship with, what are they doing in our market and how can we influence that? The first way to do that is really to understand it, to be able to have the data and analytics and understand what that looks like in your own landscape.
What's too big of a rock that systems aren't really swinging their pickaxe at yet around trying to focus more on consumers? What's the biggest thing they're avoiding?
The biggest thing that's still a gap in understanding what it takes to be truly consumer-centric is recognizing the need to invest into understanding your consumers. What a lot of health systems are assuming is that consumer centricity is about creating great experience, is about loving your customers. And while that's certainly a huge part of it, health systems don't need to be told to love their patients. They already do. There is no lack of desire to create great customer experience. But where there is lack is understanding that true consumer centricity starts by investing into understanding the needs of the healthcare consumers to much greater depth than we ever have before. What we've always focused on in the past is what is the demand? Who are the consumers demographically? What is their age, gender, and what is their likely utilization? What we need to understand is what are their needs for convenience? What does it take to get the consumers to trust, to engage? And even just in terms of access that we've been talking about, and obvious things that we may not realize unless we actually start mapping out their journey is what does it take for somebody to get to your health system? How out of the way is it? How easy is it to park? Those are the types of things that we need to start mapping out at the segment level to understand what are the unique needs of mothers with young children versus the unique needs of someone who is retired in terms of how they want to access healthcare, in terms of what emotional barriers, what physical barriers they might be perceiving. And that insight is what ultimately going to inform how we build that great customer experience and convert it into value for our consumers. It's not starting with the experience. It's starting with the information on how to build the experience that I think is the biggest missing gap in clarity on how to really go about this.
Laurie, what do you think?
I think this is actually starting to be addressed. In the past, it felt like health systems, and they still are on some level, incredibly siloed, but there's a recognition of it now and a recognition that it has to change. I used to hear 5 years ago, for an example, that's an operational problem. That's an operational issue. We don't deal with that. This isn't our department. The attitude towards that has widely changed, where there's a recognition of, yes, this might be a problem or a challenge or a hurdle from a different department, but we need to globally address it as a system, or we need to figure out the way that we're going to work together to address it, which I don't think was always the case in the past, but I think it's becoming a non-negotiable now as the healthcare landscape continues to change. And there's a recognition now that there needs to be better unification within health systems to try to tackle some of the complex problems that we're facing from a patient and consumer perspective.
You're right on. And I think one of the best examples of that is the groups I work with. I just feel like CNO's voice has taken on so much more power in the last 2 or 3 years. And you can see it's shifted from that's like a totally operational perspective to it's a voice of the patient and the consumer now.
Yeah.
Yes, absolutely.
And that's a really cool thing about it.
Thanks so much for sharing what you've been hearing, your perspective. This is a fast-moving space and a place that so many systems are making investments. It's exciting. So thanks so much.
Happy to be here.
Thanks, Trevor.
Thanks so much for listening to SG2 Perspectives. As always, I really value your feedback, input, comments, or ideas for episodes, and you can reach us at sg2perspectives@sg2.com. Additionally, I recommend that you check out some of the other Vizient podcasts, which cover a range of clinical and operational areas. Those can all be found at vizientinc.com/podcasts.